We'll be calling the Richland County Community and Health Services Standing Committee to order. Miranda, would you be able to do roll call, please?
Miller. Here. Brewer. Kramer. Here. Glassbrenner.
Here.
Harwick.
She told me she wouldn't be able to make it.
McGuire.
He'll be running late.
Barris.
Here.
Braithwaite.
Here.
Checker.
Here.
Yes, 6 for ma'am.
Okay, thank you. And are we in the open meetings law compliant?
We are.
Okay. Then that takes us to number 4, approval of our 16-point agenda. Can I have a motion for approval?
Need to read numbers.
Oh, yes, thank you. I do need to strike before we approve that. We are gonna strike number 13, and that will come back to our December meeting when we have all the information that we need. So with number 13 being stricken, I have an approval for the remaining 15.
Okay, I'll get.
Thank you. In a second. All right, all those in favor, please say aye.
Aye.
Any opposed? Okay, and then approval of the minutes from our October meeting. Were there any changes or corrections anyone noted?
I didn't see anything, I will make that motion.
Okay.
I
Yes,
will second.
okay, all those in favor, please say aye.
Aye.
Any opposed? Brings us to number 6, public comment. Is there anyone here that wishes to speak as a member of the public or online?
May I bring up a
Yeah,
couple things, Madam Chair? Tomorrow, we're doing a couple of places early with Veterans Day. We will be at Schmidt Woodland Hills at 10 in the morning. They're gonna do a small program, and they've invited us for lunch. And then we're gonna feed it down 80 to the intermediate school, because their program starts at 2. Monday is the big day. We will be at St. Mary's and Doudna before 9 o'clock. Their programs start at 9. And then the big one, of course, is over at the Richland County High School at 10. And then everyone is invited for lunch at Legion Post, where the ladies auxiliary puts that on. And then we go over to Ithaca. The program starts at 1:30. So busy 2 days for us. And you don't have to be a veteran to attend. You can attend any of the programs. The more the better.
that's great. Thank you. Any other members of the public? All right, if not, we'll move to 7A. Tricia's administrative report.
So I have in the packet, the unit updates, a couple of extra things that I want to share with you. In October on the 16th, we had an all-agency training day. Just about everybody made it for the day. And we had 2 presenters. One talked about de-escalation and situational awareness training, and our second one was on trauma-informed care. So it was a really great way that we could get out of the office, everybody get together, and be able to get provided some information that's very helpful. One of the things that we're going to be working on next is really doing an active shooter drill in our building, and we've reached out to both the police department and the sheriff's department, and they will be coordinating with us. We just really want to be proactive in case if something happens and really make sure that staff know what they should do and learn some muscle memory on what are next steps if something does happen. We had a birth to 3 program review and it went well. We were in full compliance of that, so that was wonderful. That program continues to do great work for the community and continues to year after year be in compliance, which is wonderful. And then the last update, we are working with Metastar in our office, and they are doing a security risk assessment for us. And it's really looking at our system, at our EAR, and really the layout of the building, lots of different points to making sure that we have our system as secure as we can. So that's something that the state is funding for us and that we are participating in. We're actually one of the first counties to do it. So we're excited, but a little overwhelmed sometimes because it is a lot of work, but I think it'll be good for us in the end. So those are my updates.
Thank you. Any questions or comments for Ms. Clemens? you. I just wanted to say, I'm so excited to see that we are fully staffed.
Yes.
That's
And
been
continue to be.
wonderful. Yes, exactly. Great. B is HHS expenditures report.
So that packet is also in the file. These have all been approved by Administrator Pesh, and if there's any questions on any of them, I can certainly do my best to answer. Stephanie is on her way to France, so she is not with us today.
Oh,
Good for her.
That's
Yes.
amazing. Great. Any questions from anyone? Otherwise, that's just a view option. And then similarly, 7C, which is our budget summary and Richland County placement report. Was there anything you wanted to highlight on that?
No, we continue to do well with maintaining our, being within our budget. Like our cash balance is under right now, but that's really because there's a lot of revenues yet to come in. One of the things we do to balance our budget is the WIMCA revenue, which that won't come in through December. There's some enhanced Medicaid through our economic support unit that has not come in. And one thing with the consortium for economic support, typically our maintenance of effort is taken out at the end. This year, they took it out right at the beginning. So that also has an impact on our budget. But we are feeling good that we will remain under budget at the end of the year.
Yeah, and even in, it's not gone like, it's that, but it's looking good.
Brandy and I talked a little bit this morning, and the number of emergency detentions that we have done this year has increased, but we've been better about getting people out of there and back to the community with services a lot quicker this year. So that's been a huge help for us.
Comments or questions? Okay, 7D, 2024 contract monitoring report. Anything we should note on that?
On the top of page 2, we have Evergreen Manor, and it shows that we way overspent. That is an error. We have not even used them this year, so we have corrected that on our, in the system, so that next month that won't show that. But we have expended 0 this year.
What % utilization should we be at for, it's like September?
75. And the other place, like on page 4 for Mo's transitional living, that's at 82%, but we don't have a placement there right now, so we are okay there. And then on the last page, Southwest Wisconsin Workforce Development Board, we just got that contract approved to increase to 150,000. So we will be okay on that. That was just approved at full county board last week, actually.
Okay, any questions from board members on any of this? Great. That will move us to 7E, our child support quarterly report, and I see Melanie's here. Hi.
Hello. All right, so this report is going to be for July through September. I actually just got my October numbers like within the last 48 hours, so those will be included on my next report. So our federal fiscal year closes September 30th each year. So these are our results from the last quarter. I am happy to report we hit every one of our benchmarks for the year, which we've been able to maintain the last several years. So we're pretty proud of that accomplishment. And for the 24 federal fiscal year, just Richland County agency, we collected $1.15 million in current child support. That doesn't include back support or cost debts or anything. So our staff has been continuing to do training. We went to our child support enforcement conference in the Dells in October. We made some great connections with other agencies that have offered to reach out to us if you have questions on anything, kind of helping us learn some best practices that some different agencies use that we've started to try to implement in our office to increase our performance and get more child support payments coming in. We were doing our enforcement training, was kind of just reaching out to other counties saying, hey, what do you guys do in this situation? There's been such a need, and we've learned from our regional director that there's a lot of other counties that are interested in that same training. So I actually put in a request to the partner training team that the Bureau works with to see if they would do like an actual online class. Since there is such an interest with our county and some other counties as well. So we're waiting to hear back if that request would be granted and if they would do some online classes. Charlene is actually in the middle of her intergovernmental training right now. She'll complete it next week. I completed mine over the summer. This is the training we use when we're working with other states. We have one parent in our state, the other parent lives in a different state, so we have to basically tag team our cases with the other state. So once that's done, we'll both have that training under our belt. For staff updates, October 7th, I was actually appointed the director of our agency.
Congratulations.
Thank you. It's been, I'm not gonna lie, it's been a lot, but it's going well. So I was set up with a new director mentor. Her name is Shannon Boney. She's the director of Forest County. Her and I actually have a meeting scheduled this afternoon where we'll kind of, get to know each other, see kind of where I'm at, what my needs are, and then her and I'll develop kind of a training game plan. And then I will be in a couple weeks actually starting my new director training through the state of Wisconsin. That right now it's scheduled out through, they have classes scheduled out through March. And then for all of our state required reporting, I still have regular meetings with Attorney Forehand. She's kind of passing that off to me. So her and I are hoping that maybe by the end of the year, we'll have all that transition from her to me. For our budget, I included in the packet our budget. This is through the end of September. We have received some additional state aid payments since this report was printed. So I'm estimating we might actually exceed our projected revenue for the year, hopefully. But I did want to note on, not that sheet, the other revenue sheet. No, is it up above maybe? Yep, that one right there. Thank you. Okay. So in the month posted in process, there's a negative number. I just wanted to point that out. So we do regular transfers. We have cooperative agreements with the Family Court Commissioner and with the Clerk of Court. That is just the transfer out of our budget line item into their budgets for January through June, what we owed them for our cooperative agreements with them. So it's still within the county, just going from our budget to theirs. And I did note on here on my report that we hadn't received our third quarter state payment. We just received that. I got the receipt for it yesterday. I believe it was over $65,000. I don't have the exact amount in front of me. And then as far as our expenditures, our budget is sitting at a 57% utilization of our expenses right now, which I'm very happy with, where I feel like we're kind of below the bar of where we should be. We do have a couple line items that went over some unexpected expenses. But for the most part, a lot of our line items are sitting fairly under budget at this point. So, did you guys have any questions for me about this?
Just one,
Yes.
in my own interest. How do you get over 100% paternity establishment?
So it's a calculation that they do. It's based on all births in the state of Wisconsin. We are only establishing paternity on cases that have referred over to us where the child is receiving public assistance benefits. So if you compare us to the average of overall paternity for the entire state of Wisconsin, whether the child's receiving services or not, we are exceeding the state average. So we're doing better than. It's a whole mathematical formula. Let the state run those numbers and send it in a nice little report to me. Yeah.
Madam Chair,
Yes.
so I just want to commend Melanie and Charlene. They kind of, well, not kind of, walked into a mess. There was a lot of stuff to be cleaned up, a lot to learn, a lot to organize, a lot to determine. And both of these ladies have stepped up, have really just taken charge, have advocated for themselves, have advocated for the agency, have embraced everything thrown at them and done an absolutely outstanding job. The fact that we've got 2 newer staff and we're still exceeding all of our benchmarks is very impressive, very amazing. And so I just want to commend both of them for their outstanding performance because really, truly, they've done a great job with the agency. So thank you. You're very welcome.
Thank you, Melanie. Great. Moving on to number 8, child support quarterly report. Or wait, I'm sorry, I just said that one. Approval of contracts. You can. Not asking you to read. It's okay. Right, looks like we have 2.
So we have 2 contracts. One is Tracy Benton. She is a provider through CCS, had previously worked within an agency and now is going out on her own. So we're asking for a contract with hers. I know it's only 2 months left of the month, but she does have established clients that once the contract is established, she'll just continue. So that's how we came up with that number. And then the second one is Mystic Creek Adult Family Home, and we needed a location for emergency protective placement, and she was able to work with us on that. And so we have a contract, we need a contract for that.
Great. Any questions from anyone? Otherwise, we'll need a motion to approve these 2 contracts.
I'll make the motion.
Thank you, Ms. Kramer. Do I have a second?
I'll second.
Francis, any further discussion? All right, all those in favor, please say aye.
Aye.
Any opposed? Okay, number 9, discussion and possible action, ARPA spending plan.
So this is one that we continue to talk about. We have our ARPA dollars through our public health unit. And it was a request of this committee to be able to kind of oversee to make sure that we are spending the money as we should. We will have projected right now about $37,000 remaining. We do have a couple of projects in the works that we're going to be spending the money on, but it's only about $3,000. So I have reached out to our MIS department to see if there are things that they need, and then we'll be reaching out to Administrator Pesh to talk about, are there other ways we can utilize these funds before the end of the year. So we'll continue to work on trying to wrap up these funds.
Okay.
Yes,
It's good.
but I don't think we need a motion on anything. We just really wanted to bring it to your attention.
Extra dollars are never a bad thing.
Yes.
Yeah. Okay, number 10, discussion and possible action, resolution awarding opioid settlement grant funds. There were in your packet, let me scroll down there. We have 2, I believe, different applications. Or is there 3? 2, yeah, and with their supporting documents. If you want to just kind of review for us what's the total amount that we had to spend, and then I think, is it 10E that goes over, someone didn't download for me. Is that the one that went over like our grant application process?
Yes,
Okay,
and I apologize, I just got that added this morning, so I was almost
No,
done last
that's all
night.
right.
Realized I forgot to add that.
but maybe just give us the highlights.
Sure. So right now, Richland County has close to $160,000 of opioid settlement funds. There's more expected to come, but it really kind of depends on how lawsuits or how if there's bankruptcies or different things that are in there, and it's over the next, I believe, 10 years. We had a committee that was put together to determine the best way to utilize these funds would be to offer grants to the community. And so this is the first round of grants that are going to be offered. They are to be presented to this committee with a recommendation for approval to the full county board. So they will go to the full county board in December for their approval if based on your recommendations.
And I'm sorry, this just finally pulled in, so I was looking at the total, which will be 489,794, but that's through the end of 2038.
Yes.
So this year, is this year the most that we get in one chunk? Do you remember?
This has been accumulating since I started in 2022. So we just slowly get little chunks in. We don't really know when we're going to get them. It's really when they kind of make that final settlement agreement, and then things get kind of shared. Candace usually will get an email that says, hey, you gotta enter into this agreement to get your money.
Yeah, typically I get updates from the law firm that is representing us. They're continually working on additional settlements. So oftentimes, yes, I will get an email that says, oh, you will be getting this settlement. And I tell the treasurer, so they know it's coming. They make sure the funds get to where they're going to go. But it seems like, God, every month I'm at
Yeah.
least getting something new, or there's a new settlement or there's a new agreement. So yes, it just kind of trickles in and then we do what we need to do with it.
And some of it is invested, so we are earning interest on
Correct.
some of the funds also.
Yes.
So for this year, I'm sorry if you already said it, what was the total amount we have to award this year?
We never decided that. Like, we never
Oh,
decided.
If it was per year, it's just how much
Correct.
we have, so how much do we currently have? It was one.
We have $159,097.71.
159,000, okay. Hi, Dan. So, okay, if you look at the agenda item cover, which is number 10, it just goes over the fact that we have 2 grant applications to look over and that we had decided that what they should be utilized for the grant was prevention, treatment, or recovery of opioid drug use and its various effects. So then, if you guys look at, and hopefully you got a chance to review this, 10A, 10B, and 10C are all pertinent to the first application. So 10A would be just the cover that talks about what the organization name is. So that's the Richland County Treatment Court, and Sue Larson is here. So if you wanted to come up, Sue, so that you can talk about this, that would be great. It's talking about the All Rise 25 conference, and then it gives you the grant amount request. If you look at 10B, it goes into more detail, and then 10C itemizes where they're getting those costs from. So I'll let you speak to that.
Does anybody have any questions, I guess, before I start giving information?
Maybe just give us a little overview of the
Yeah.
background of this.
So Treatment Court, Richland County Treatment Court has been going since 2017 here in the county. And they first started with a sobriety court, which was just for individuals with offenses with alcohol. Drug court has been implemented in 2022. And so it has to do with individuals of taking an alternative instead of doing jail or possible prison time. They get to do this treatment. Oh, sorry, she was supposed to stay. She's not listening today. So it's help, the treatment court is to help reduce recidivism. So we've had so far from 2017, we are coming up on number 32. 32 people have graduated from the program since 2017. And so what is involved also with treatment court is a lot of like training. So the state and or federal government provides training to how to provide these services and what these services, best standards of practice should look like. And so they've recently just been doing this big shift and this big change of how the different phases that the individual step through. So staying on top of the standards and best practices can be a lot of work and involve a lot of training. So wanting to go to the national conference in May, which this coming year in 2025, it's in Kissimmee, Florida. And we got the idea actually because Iowa County Treatment Court team went to California, Anaheim, California this year with their opioid money. They asked their county for some opioid money to go to their conference, and they went. And so we thought, well, hey, that's a really good idea. Maybe we should ask for opioid money to go to the conference this coming year. It involves 3 or 4 days training, which is all involved in the packet of kind of explaining to you like how many days we would be there and what that involves. So we all go. So the treatment providers are on the team. There's the district attorneys on the team, public defender, law enforcement, probation, the judge, of course, a treatment coordinator. Who am I missing? And that's probably everybody, I think. that are part of this team to help provide these services for our county, this treatment court, to help them reduce or help our county to reduce recidivism, which, as you know, can save our county money. So overall, too.
Okay, so if you, like I said, hopefully you guys had a chance to review those. Do you have questions, clarifying statements? We can have some discussion here on what we think about this. Because what we need to do is decide whether we recommend this or something amended from this, or whether we recommend it for denial. We either have to recommend for approval, for denial, or an amendment of this to move it on to the county board for approval.
You're, I'm sorry,
Yeah. go
you're
ahead.
asking for up to 30,000?
Yes, because based on, projections that I made of like looking into the various, like airfare and all of that, that could change, right? So that's why I said up to, and I figured it for 10 people to go on our team, which is about almost pretty much everybody. Maybe it would be 9, it just depends at that time. People would have to make a commitment by a certain time, but it would be at least up to 10 people that would be going, and that's what I figured the prices for, the cost for.
And are most counties that are going sending their entire team, or just some representatives from their team?
They have sent the entire team, like Iowa County, their team is probably a little bit smaller. I think they had 7 or 8 people that went.
Okay.
Is there anything in your budget now for this type of education?
So the budget is through like the TAD grant, which is the treatment alternative and diversion, and the county gets $130,000, and then the county matches 43,000. But I don't believe that we can put monies or ask for monies to go to conference, but maybe in the 2025 budget we could, but usually you have to change something, and Brandy might have more answers to that as well too, if that's a possibility.
As of right now, we always budget for the state conference. It's never been budgeted for the national one. There's a list of like approved conferences and training that TAD would call under. So we'd have to see if this was one that would be added, that could be added for TAD to fund.
Okay. Sorry, I had a question and it just went out of my mind while I'm thinking of it. Anything else, Dan? Did you have your hand up?
I'm sorry, I was reading up there.
Okay.
What's it?
No, I thought you had your hand up for a question. Have you guys looked into any other grant funding, anything, since it is through the, what does it say? National Association of Drug Treatment Court Professionals?
Yeah, no, we have not.
Any thoughts? Tricia, had you done any looking into this? Any comments you wanted to make?
The only thing is I talked with the Columbia County Director, and they send 4 per year. Because I did talk to other counties, just to one other county, to find out who they send or how many they send, and they sent 4 per year.
How
So
many is
they-
on their team?
I guess I didn't ask that, but.
I don't know how big Columbia
I
is.
think Columbia is 50,000 population, so they are bigger than us. And they do work that into their regular, through their TAD grant. I don't know if they have the TAD grant or if they have a different grant, because there's other grants that can fund treatment court, but they send
So-
4 per year.
Through the TAG grant? Are you saying, or in addition with monies, other monies?
They do it through their grant,
Oh.
through their treatment court grant.
Okay.
Which would make sense to me, because you only get so much money for that.
Correct.
Yeah.
You'd only be able to
Yes.
say, you wouldn't be able to send everybody. As you can see, it's a pretty big amount just to send 10 people.
Yeah.
Other questions for me?
This goes on every year?
Yeah.
Obviously.
Yeah.
So is there an advantage to sending everybody 1 year as opposed to half 1 year and half another year? To update?
I mean, that would have been maybe my thought, to see what you gain from it and how much you can implement from what, the conference is. 'Cause sending 10 in a year, I mean, that's a large chunk of money out of the monies that we have. The other consideration that I would say, because I do think that this is a valuable education, I'm not arguing that. The only thing I would say is we don't know yet what other requests and what other initiatives there might be for this grant funding money that we have, which is currently at about 159. Not saying I'm opposed to this, I'm just saying we need to think about those things all in consideration.
There isn't a deadline date to use the grant.
And I,
Oh,
it's not a
yes.
question, it's more of a comment, knowing the value that can be achieved in team building and I mean, often whole teams leave these types of conference with a really good game plan for change because they've been together at the same conference, at the same table, et cetera, with a lot of other people. And there's just a lot to be gained by education of that sort. And it may be that, you know, I like the suggestion perhaps to plan on sending as much of the team as possible this year, whether it, you know, the cap is 10 or the decision is made to cap it at 8 or whatever, and then, but continue on, but not the whole team after, depending on the national conferences are valuable because you get information from across the country rather than just within the state that you're in. That's just would be my support for strongly considering sending as much of the team as can this first time. Because has anyone ever been to the national conference?
No. We've always went to the state.
Yeah.
And this is kind of where it kind of like came off of too in April when we went to the state conference is of how much that we kind of learned and looking at the standards of some of the things that they've changed in the standards and what we are trying to also implement and to do and how beneficial it is and of staying on top of best practices the best that we can and how can we offer these services.
And the topics that are covered there are mostly related to treatment and recovery?
No, so there would be some like seminars for like the public defender or the district attorney and the judge and like every law enforcement. So they would offer different seminars for each position on the team. And so each team in each county pretty much has the same layout, whether it's treatment providers, law enforcement, DA, judge, all positions. We have all those people on a team. So when you go to a conference, there's also seminars offered for each position on like how they can, what can they do for their position on the team.
And I guess what I'm getting at, my interest is the prevention area and making sure that some of our counties allotted funds are a good portion perhaps are somehow spent on prevention so that they don't end up in treatment court and the expenses for that kind of hopefully dwindle a little. But, and I see that the other grant that was requested also had prevention checked in addition, and it was for the treatment court, also had prevention checked. And I just wondered if that was an aspect at all on the agenda at the national conference.
Prevention in itself.
Yes.
I think and I don't know how Savannah meant hers on her prevention for marketing and hers. I look at prevention as that we're trying to prevent the participants from going back out in the community and using.
Preventing recidivism.
Yeah. Yep.
Yes, Dan?
This conference, would this be strictly in person, or would it be telecommunication type conference?
Yep, it's all in person,
Hey, pardon, what?
all in person.
Okay.
Yeah.
I think that's the best way, seriously. If we're gonna get big, I think telecommunication wise, I think something would get lost, you know?
So I guess I would have some further clarifying questions. And one of the questions I had was when was the deadline to register, which Trisha just found. It looks like it's in January is when registration opens for it. So I guess a couple of my questions. Again, I agree that I think these things are valuable. I think that there's something to be said for team. I think all of those things are accurate. I also think that we as a committee do need to be careful in balancing what are some of the other needs, what are some of the other requests that may be out there that will go towards all of these things as well. And to keep in mind that this is a large chunk of money. So I guess, at least on my part, I would like some more information on if the TAD grants were able to also be utilized. Is there any room in that budget to then maybe offset some of these? That would be one question I would have.
The TAD budget. I don't think the TAD budget could fund 10 to the state conference and 10 to the national conference. Like, I don't know if that would even be a possibility. I think it was pretty tight when we were putting numbers in right now because treatment court does keep growing. We've underutilized TAD in the past, but pretty consistently all year we've been higher numbers. So we're using more funds in different areas. So I don't know how much wiggle room there would be in TAD.
I guess that would be something that I would maybe want some information on personally, because I think if that is the case, if that can be utilized towards that, then that would be something to use towards that before we then spend these monies on that. I also, so did 10 people go to the state conference? Was it this year, 2024? Or was that last year?
I don't know, 10 went,
The
but
full
it was,
team hasn't gone in the last.
Okay.
I think it's usually like eight
yeah.
or so.
Yeah, okay. Another question I would have was, I know you said you spoke with Iowa County. I guess it would be interesting to know, and I don't know, maybe this is asking a bit, but I would like to know, like, what did they bring back that they felt like was, have they been able to implement those things? Like, did they feel that it was valuable to have all 10 there? Are they all able to implement? Do you know what I mean? Or is there some value in sending perhaps part of the team having report back and then sending another portion? Because going forward, I don't think, it's not like we can't fund $30,000 every year, obviously. So, like Dr. Barris said, is it good to just send everybody once, or would it be more beneficial to try to do some per year?
Is that a question or a request?
I guess I'm just thinking out loud and wondering if there's more information we could have about that.
I don't know if there's a right or wrong answer to that. How they're looking at doing some of the phasing and how they're looking at with the standards right now, it's, a lot more so on the treatment provider. So treatment providers for sure, like, probably need to go to the conference, stay on top of some of this information because they're doing most of the work with the participant than anybody else on the team. But it is valuable information because we also go and we learn, like, we went to the state conference, we learned about a program in one of the other counties in Wisconsin that law enforcement, that they started, that law enforcement are, some of their law enforcement are being mentors with the participants in treatment court. So there's even other programs like that, that other individuals on the team then, and we see as a team, and is that something that we want to bring back and try to implement in our county as well? So, I don't know if I answered your question, but I mean, yes and no, I guess. There's a really straight answer for that. Because sometimes there could be things in a seminar that could come up for law enforcement or the public defender or something that we wouldn't necessarily maybe know about if they didn't go to that.
Yeah. Okay, so.
So Iowa County, and I don't know if I'm gonna put this on myself, but they sent them to go, and I think, like I said, it was like 7 people, but then they came back and did a presentation for the board too, to show them what they learned and stuff too.
I
So,
think would be great.
I mean,
Whatever.
Yeah,
Whoever goes, that would be
yeah.
good.
yes,
I mean, I don't
for
do
sure.
that on myself, but it could probably be done by somebody, so.
Yes.
Is there a way we could divide it so that some go to the state and some go to the national and then they do their collaboration together, you're gonna get a lot of stuff there too. You might miss out on a little, maybe some of the personal things, but at least you'd get a lot of information.
And some of it can overlap as well too a little bit, but that's okay, because then you're learning it again and again to really understand like how to implement some of these things or new things. Sorry, I don't know why she doesn't use this, so.
So one more question. So is it cheaper to go if they would divide it for the state level and the national? So many go to so many, and then they collaborate together on what they learn.
I
We could
guess
do
to
that.
piggyback on that, is it a requirement that you go to the state one? Is there gonna be enough overlap where like, say instead of going to state, you just go to national? Do you know what I'm saying?
The state conference is 100% funded by the TAD grant, so that one,
Okay.
there's no extra money that goes into that. When we do the TAD budget, we budget for 10 to go for their hotel room, mileage, meals,
Okay,
things like that.
so that's already been budgeted for
Yep, that's already
2025?
been budgeted for 2025 for the whole team to go up to the state conference.
Okay. So we do have we as a committee have another meeting prior to a full county board meeting in December. So if you guys had specific information you'd want before making a recommendation or decision, we could have this come back to our next meeting. We would need to decide what more information we'd want or what we might recommend to Sue. Yes,
Madam Chair, when you go to your state conference, I'm just wondering if, I know you learn a lot of stuff from different counties, but I'm wondering by going to national, if it would really benefit the state of Wisconsin, especially Richland County. I know counties can share, but I don't know where how do I want to say this? The jump between different states takes place, if it would be beneficial. I mean, like say, where is it? It's in Florida, but Iowa County went to California. What I'm saying is, I'm wondering if going to a national conference, learning national stuff is really going to benefit, because laws are different in different states. And I don't know if they're doing a blank page for every state to do the same thing for every court. I don't know that, but
In some ways, yeah, so it's not necessarily about like implementing laws, it's implementing a program. And so it's implementing a program and what that program could look like or should look like based off of best standards, best
so
practices,
it should be the same all the way across the United States then when it's done.
pretty much, yeah.
all right, board. I can't make a decision for you, so I need to hear from you guys what you think you want to see going forward.
I think it should come back.
Okay, with what further information?
Maybe to send half and they can come back and maybe do a little in-office training on what they learned, what they saw, and then maybe later on send the other half.
But that's excuse me, but that's a motion, not a coming back. Isn't it?
No.
Are you saying you'd want to see revised numbers for that amount? Okay, okay, any thoughts on that? Yes,
Question. Is there an agenda of different types of trainings? Because maybe if the committee knew exactly what is this, instead of just saying it's a national conference, what are the breakout sessions look like? Because I think that would be helpful. So then you know what are people going for.
I could maybe get you last year's, but the breakout sessions obviously aren't set up yet, because it's not until May.
Right.
Last year's would be great.
Let me see if I still have access to it. They may have taken it off of the website.
yes,
I guess as an alternative, if we are really talking about deferring the action to the next meeting, is there room from a budgetary standpoint, or are there other options for some of the funding to come from other pockets of funding to send the team or a member of the team? Is there a way to cost share between what is being requested from this grant with another either already budgeted amount for 2025 or another grant source? So 30,000 wouldn't be what wouldn't be the chunk
Right,
that would come from this grant.
okay. Other thoughts? Yeah,
I may have missed this, but where's the location of the conference?
Semi Florida,
In Florida.
yeah.
And does this location move around the country and every year or so?
Yes.
Is held every year?
Yes.
Okay. Right. Give me an idea where it's gonna be next year.
Yes, Nashville.
Nashville,
Yeah.
okay, it's getting closer.
the year before that was California, which is. All right, well, how do you as a committee then feel about having this brought back to next committee meeting with some information about, again, I know we mentioned like, what about the TAD budget? You were talking about other funding sources, or could we narrow this down and see, you know, is there a certain portion of the team that it would be most beneficial for, where we're not sending all 10, just have some other options like that? How do you guys feel about that? Do you think that is something that you're able to look into and bring back?
Sure. What's the
Okay.
date of your next appointment?
Our next meeting would be on December 5th. Does that sound right to you guys? First Thursday? And as of yet, we don't have our planning board date for December, do we?
Yeah, we do.
We do?
It's the 10th?
Let me look.
December 5th is this committee's next meeting at 9:30.
Oh, yeah, it would be the 17th. Because it's
Okay.
the third Tuesday would be, so the 17th would be the county board meeting. Since there's, yep.
Okay, I thought I saw an agenda, decide date for December meetings. That's why I asked.
Isn't it usually the second Tuesday in December?
Yeah, so I don't think that it's set
Oh,
for
that's
the.
right, it is the second Tuesday, that's right, there's that, so
So
yes.
you were right, Sue.
Yep.
Be the 10th. Wait, but that's our executive
No,
meeting.
that's executive, so we either have to decide to move executive, or we have to decide whether we want the board meeting on the 10th. We may just move executive.
Okay, well, either way, we'd have enough room in there to move that forward. Okay. All right,
Yes, yes, that is. All rise, allrise.org, which I think I put in the thing.
Email or something?
What's that?
Can you put it in an email or something?
Sure. Yeah.
But anyway.
Thank you, Ryan, for coming.
okay. Thank you, Sue. I know
Yes.
that this is a lot of work, but like we said, we're just trying to be responsible with the funds and with the amount of, you know, opportunities that are out there for funding as well for this. I think that this looks like a really good option, and so we look forward to hearing what you come back with. Thank you.
Yes. So Dr. Barris wants the email to the allrise.
I can get it out.
Okay, thank
You
you.
can take care of it.
Okay.
Okay,
I will ask a question or answer questions about the other application too, so.
all right, perfect.
Yes.
So that goes to, let me see, 10B then. So this is treatment court incentive funding. The grant amount request is $5,000. Says it needs prevention, treatments, and connecting people to resources and expanding resources. Could you give us some background and information?
Yeah, so with treatment court, one of the things that we do is incentivize, right? So we want to like give individuals rewards for things that they're doing that are positive, whether it's sobriety, whether it's coming to appointments, whether it's coming to court, whether it's not having any violations between the court dates, things like that. So some of the things that they get for incentives are gas cards, she buys, they get to pick out of a basket every week if they have any violations between the 2 court dates. All kinds of other things that she buys that then participants can buy with these decision dollars that we hand out. It's like pretend money, and they get to spend this money in a little, these things that Savannah buys, the treatment coordinator buys to incentivize them. So rewards them for their hard work that they're doing. And what's happening is that the TAD grant, where we're getting the money from, is not allowing any monies to be spent on incentives. So we have to find someplace else for the monies to come from to spend on incentives for the year. And she came up, it looks like, for $5,000.
Questions from the committee?
One thing that I will add, the TAG grant used to allow incentives, and they have different people that are overseeing the program. And basically the gist of it is it's too much work on their end to track all the incentives, and that's why they're not allowing it in the grant. Not that it's not allowed, they're just not going to allow their funds because they don't want to have to track all of that.
One thing too I want to add is also for graduation supplies. So we used to be able to have graduation parties and all things because it's hard work. It's 18 months long. They're trying to get sober, abide the law, reunify with their families, all of the things. So after every graduation, there's always a graduation party in the county boardroom, and we're also not able to use any TAD funds for that as well. So we're asking them to do all this work and then they get anything at the end.
And that's in this 5,000 too, is that what you heard in there too?
One thing I want to mention is that although they don't have a specifically itemized list on this, that is a part of this, that they would have to provide itemized list of what they've spent those dollars on.
So it's set up as reimbursement rate. We're not just gonna give them $5,000, they're gonna give us a receipt of what they purchased and then reimburse them.
Questions from the committee? Thoughts?
Madam Chair,
Yes.
so you don't directly give the person the money? Okay.
You said that possibly got gas cards, was that? one,
Yeah,
or
the
things like
gas
that?
cards is one of the things, this has a whole basket of stuff, and I don't know what she has in the little store
There's like
anymore.
candles, hand towels, plates, cups, things for houses, things like that.
All right, so either you would ask for more information or we move this on to the county board. Or, I mean, if you guys wanted it to wait and go in tandem with the other one, that's fine too. But I mean, if we don't have any clarifying, no concerns, we can move it forward.
I make a motion to move this on to county board.
I'll second that.
Okay, did you want to have further discussion?
No, I was
Okay.
going to make the motion.
Perfect.
I raised my hand.
Okay. Sorry. Any further discussion? If not, all those in favor, please say aye. Any opposed? Okay, that one will move forward to then this nice.
Thank you.
Yes, thank you, Sue. All right, number 11, discussion and possible action, Richland County Transportation Program 2025 Vehicle Lease Agreement and a Memorandum of Understanding.
So every year, so the transportation program through the ADRC is the one that writes the grants for new vehicles. And then, so we usually use those new vehicles. We wrote a grant for Pine Valley a few years ago. So they have their bus at Pine Valley. We just have to do a memorandum of understanding with them each year because there's different requirements they have to meet for reporting with our grants. So we do a memorandum of understanding each year with Pine Valley for that. And then we also lease one of our older vehicles to Schmidt Woodland Hills. That vehicle, we got our new vehicles in 2020 and 2021. That freed up one of our older vehicles for Schmidt to use. So this is also a request to approve their yearly lease. Caveat to that is I don't know if they're going to continue for sure. We're doing this just in case. However, the vehicle is old. It's got about 190,000 miles on it. So they may return it at the end of the year. But this, at least, if they decide to keep it, then we have it in place and they can move forward for next year. I just need approval to be able to do that.
I make a motion to approve.
Okay, do I have a second?
I'll second.
Dr. Barris? Any further discussion or comments, questions? Okay, if not, all those in favor, please say aye. Aye. Any opposed? All right, number 12, discussion and possible action, resolution approving purchase of new computer.
So we are in need of, on a yearly basis, we take a look at what computers need to be replaced. And so this is our total list of computers that need to be replaced. We will be using ARPA funds, so some of the public health ARPA funds we'll be using. We'll be using our MAC grant funds and then the ADRC carryover fund. So there will be zero levy in these purchases. And these are the computers that are aging out this year and we'll be needing to purchase new ones anyway. So it's nice when we have available funds to purchase them instead of having to use levy.
Yes, absolutely.
How many are you?
So we are needing 2 desktop computers, 12 laptops, and 10 monitors. And the reason we're getting those extra monitors is because many of our stations have 2 monitors because they work on both screens when they work.
Did we replace a bunch of computers recently?
We have 60 employees though, so we
Right,
do,
that's wondering
yes.
how we are in the
Yeah.
cycle.
Yeah, we're doing pretty good. I mean, we've been able to utilize grant funding. I know either earlier this year or last year, we utilized economic support ARPA funding to replace a lot of those computers. So a lot of those were done with those economic support ARPA funds. And then we've had these, I don't know if we've had any other big purchases, but I remember doing those recently.
I make a motion to approve.
You're on a roll today, Ms. Kramer. All right, we've got a motion and a second by Francis.
Yes, I am.
Any further discussion? All those in favor, please say aye. Aye. Any opposed? All right, we skip number 13, go to number 14, correspondence. Okay, and then future agenda items. We will need the opioid settlement grant funds back on the agenda next month. We're gonna have number 13 on the agenda next month. Was there anything else? Anything from you, Tricia?
Not that I can think of right off the top of my head.
Okay, sounds good. So our next meeting will be on December 5th at 9:30. I have a motion to adjourn until our December 5th meeting. Cindy,
I move.
and a second. Francis, all right, all those in favor, please say aye. Okay, any opposed? All right, we are adjourned. Thank you.
Next meeting,
December 5th at 9:30.
December 5th.
December 5th.
Okay.
I think if we put a box or piggy bank up here, every time somebody's home